This video is talking about consultants and hair transplant consultations. A big motivation for me to shoot this video is something I heard this week from one of my staff members who was telling me that she heard somewhere that in Dallas, someone she knows, an outfit here, is there. The salesman is the one meeting with the patient, not the physician, and the salesman is paid based on a commission to close deals, and they have to close a certain number. And I will tell you that's very antithetical to how I see things. So I will never sell someone something they don't need, but in the world of hair, it's a different situation than when it comes to facial cosmetic work. So for example, if someone's 45 years old, they have some sag in the neck and jawline that would merit a face and neck lift, even though it may be something that is not terribly sagging, I will perform it for them. But if they don't need one, like I just actually did a consult today for a lady that would be a great fat graft candidate, 43, she asked about face and neck lift. I said, you really don't need one, you look good. I will also tell them that. But the world of hair is a very different situation. If you do a facelift on someone on the younger end, there really isn't a lot of consequence to do another facelift for them in 10 to 15 years. With hair, the biggest risk is a disaster that you can't fix in the future. I like the expression, the cheapest hair transplant you get is probably going to be your most expensive. So no matter if my business is busy or slow, I'm in a slightly slower season right now, and I still maintain the same level of ethics, which is I will turn away every patient that should not have a transplant. And that's really important. So if you come in and I jump at the chance to say, look, you really need a hair transplant, it's because I think you really need a hair transplant. I think you're a safe candidate. So who makes an unsafe candidate? There's so many out there. I just had a patient that responded on my video, Don't Be a Turkey and Go to Turkey, where he said, well, I had a safe transplant, I'm 22 years old, I'm a dutasteride, I should be really safe. And I said, no, I mean, 22 is a very young age. There's a lot of risk when you're doing that transplant that young, even if you're on dutasteride, because you never know what's going to happen. I mean, what's going to happen in 10 years, you could have a situation where I can't really transplant into the area or maintain the result because it's too young an age to do a transplant. So I would be very cautious to meet with a salesman, especially one that's very pushy, that's trying to tell you, hey, you need a transplant. I've had a lot of patients come in here that they said, oh yeah, I've been to 3 other consults, and then when I met with you, you're like telling me not to do a transplant. I've been told I need one. Oh, I remember one case where a patient came in and the first person told him he needed 5,000 grafts, and then the second person said, oh, that's crazy, you don't have 5,000 grafts, you have 2,000 grafts. And so when I looked at him, he has no grafts, and the reason is he has what's called diffuse and pattern alopecia, meaning those grafts are all thinned out. They are not going to survive more than 2 to 5 years a transplant. He's going to have scars in the back, no matter it's FUE or strip, and he will have, his grafts will fall out of his head within a few years at most, even if they will grow at all. So that is something that's a real problem, is not understanding the risk of doing a transplant, because once you do a transplant, you can't exit on that transplant. So you really want to make sure you pick a safe candidate for this. And so when you're dealing with a consultant whose primary driver is closing a deal, making a dollar, making sure that you sign up so that they can get their bonus and their commission when they have no clue about hair disease, they don't know about diffuse and pattern alopecia, they don't care if you have it, they don't care your age, they don't care anything. One of my staff members used to work at a major chain outfit in Dallas before coming here, and she said the first question they would ask the patient is how much money they made, or that's on their intake form. And that's a really sad thing, because you know, if you can't afford the service, it's great, don't do the surgery. If you can't afford it, great. But what I always say, that the money that you can't afford is this bank, the donor bank, because a donor bank is an area that has limited supply, and you cannot replenish it. It is something that has dwindling supply because you encroach on that area with progressive hair loss, and you steal from it for transplants. And you never want the supply and demand curve to cross. So you have increasing demand with ongoing hair loss, you have decreasing supply for the reasons I've enumerated. You want those curves to sit like this, but once they cross, it's a difficult situation, you can't fix it. So it's really important for you, especially if you're in a consultation with someone, that you don't feel like you're just being sold a bucket of nonsense so that they can get their commission and close out. So I believe a physician not only should be part and parcel of the entire consultation, but that physician should be intimately involved with your surgery. And that's the second part, which is a different video that I've shot at some level that probably will need a reshoot, which is the black market, which is the physician no longer is even part of the surgery anymore. It's a turnkey operation. They've been sold, and they basically are not part of the operation. They're not part of the consult. They're not part of the operation. They're not harvesting grafts. They're not designing hairlines. They don't even know how to design a hairline. They don't even know, angles, anything. They don't care. They're getting a check, a fat check at the end of the day, and that's absolutely disgusting and very sad. So hope this video is not too abrasive, but I think it's an honest understanding of where we are right now in the industry, and hopefully you'll make some good decisions in terms of finding an ethical, compassionate physician that will do the right thing for you as a patient, not the right thing for him or her as a surgeon or physician.